self-isolating, none are hospitalized. 2 of them are close contacts with cases, and 1 is under investigation. And all of them reside in Simcoe County. I've spoken before about the information that we have up on our Health Act website. So it provides a lot more information now about severity of cases and how they break down in terms of age, for example. I've spoken in some depth about the pattern there, but basically the pattern is that age is a strong determinant of severity of disease. Those that are older are more likely to become cases. They're, in general, more likely to become hospitalized, except for those that are above 80 who are more likely to die, but generally have been passing away in a long-term care facility rather than in a hospital. And also, when you look at our data, the pattern has been a shift such that in March, the majority of cases were acquired through travel, and in April and May, you had more in the way of transmission in the community as well as in long-term care facilities. So certainly invite people to have a look at that data. We do have, with our epidemiological curve, a pattern of somewhat of a plateau, a sawtooth pattern because of relatively limited numbers, but overall flattened. I would say that one of the encouraging findings that we've had is that in the past week, the number of cases, the incidence of cases has actually come down from the previous 3 weeks. So last week I was concerned there was an upward trend in cases, and that the incidence of cases overall had been going up over that 3-week period. And then in the last week, the week of May the 11th to the 17th, we've had a drop in our weekly incidence of cases. So in that week, the incidence was 8.5 per 100,000 population over the week period, versus the week before that, May the 4th to the 10th, our incidence was 10.1 cases per 100,000 population. So that's definitely the beginning of a good sign, and we hope that that continues. When we look at the numbers of cases that we have this week, they too appear to be down, which is a very good thing. We perhaps have in the range of 5 cases per day or less, 3 in the last 24 hours. And if you go back to the previous weeks, we had perhaps in the range of 8 or 10 cases per day. So that is a hopeful sign for us in Simcoe, Muskoka. In comparing notes with the province, they've had a stall, I would say, in a drop overall, perhaps a bit of an elevation over the last few days in daily case count compared with before that. So that is, I think, a little bit of a precautionary note for the province as a whole. And I think it's still important for us here to never take for granted that the control that we've achieved has been through our physical distancing practice, and people exercising that, people keeping a 2-meter setback from others when you go out, being careful about when you go out, hand washing frequently, staying away from crowds, and if you develop signs or symptoms of a respiratory infection, putting yourself into isolation and seeking assessment and testing. Very important for people to get tested. Certainly the Premier has been very encouraging of us all to heighten the testing that's been happening, and that really comes down to people taking advantage of the opportunity to be tested if you have symptoms. We do have 7 assessment centers in Simcoe, Muskoka, and they do have the capacity to see people to get this done. The province has changed its requirements for testing so that now there isn't a priority group per se. Anyone with even one symptom of the listed symptoms would be eligible for testing. And when you become positive with a test, that helps us a great deal. We can follow up with you. We have been able to follow up with all those reported to us from the laboratory system as being positive, we followed up within a 24-hour period in order to find out who the contacts had been and to arrange for cases and contacts to go into isolation to prevent further spread.
Positive with a test, that helps us a great deal. We can follow up with you. We have been able to follow up with all those reported to us from the laboratory system as being positive. We followed up within a 24-hour period in order to find out who the contacts had been and to arrange for cases and contacts to go into isolation to prevent further spread. I'm going to have a look at and speak to the remaining outbreaks that we have. So since I last spoke to you, we have declared Bradford Valley Care Community to be out of outbreak. So its outbreak is finished. So we remain with Owen Hill Care Community and Bayview Retirement Home and Collingwood Nursing Home as still being an outbreak. Owen Hill has had a total of 48 positive cases with 11 deaths. So of the cases, 21 of those have been staff and 27 have been residents. Otherwise, we've tested everyone in all of these facilities and had the results come back, and the others tested have been negative. Bayview Retirement Home remains with 3 positive staff cases and 2 resident cases, and that is unchanged from yesterday. And then Collingwood Nursing Home has had 3 individuals without symptoms who tested positive as part of our universal testing endeavor required of us by the province. They're the only home in which we actually had findings of positive individuals that were asymptomatic when otherwise the home wasn't an outbreak. And I had reported before that there was one individual that had developed some respiratory symptoms since. I understand from further communication with the home that that person has had a history of allergies, and so it's possible that the symptoms are related to that. And also that we've had follow-up tests come back from these individuals that have been negative. So we continue to keep that home designated as being in outbreak as a precautionary practice. But we need to evaluate interpretation of the test results given the follow-up negative results. At this point, I'm going to turn to our media questions. So the province announced that overnight camps will not be allowed to operate this summer, but there will be the ability for day camps to operate, provided that they can meet requirements from the province, public health requirements in order to be safe. We've had a lot of questions about what exactly that means. We are awaiting guidance from the province to apply to the operations and the preparation for these camps. We know that it takes a significant amount of lead time to have these camps up and operating. I've just spoken with the CAOs of the municipalities about this matter. They did request as much lead time as possible in the way of guidance as to what's actually going to be required for them to operate. For sure, it won't be business as usual. For sure, there'll have to be changes to render them to be safer. The moment we have that, we're going to be putting that out to our camps so that they can be prepared and we can offer guidance as needed. I have heard some concerns raised in social media about allowing such camps to happen, and I would say that there is always the potential to withdraw the allowance of camps, day camps, from operating if the conditions aren't safe. And that would go for individual camps, and that would go across the board as well. If it turns out they were getting a surge in cases, then we or the province could withdraw the allowance of that to happen. But it does take a significant amount of lead time for them to prepare, so they need to know now whether it's possible, and they need the guidance from us now to be able to prepare. Hopefully that we're able to proceed with that, and hopefully that the case count that we have here in Simcoe, Muskoka, and for the province as a whole comes down. There's been an announcement from the Chief Public Health Officer of Canada since I last spoke, as well as the Chief Medical Officer of Health of Ontario, about masks, about homemade masks used in the community. Formally, the Chief Public Health Officer's position was that they may be helpful to wear if people are in situations where they cannot effectively physically distance, or they can't maintain 2 meter setback from other people. And such situations might very well be small shopping locations, or it could be in public transit. The position now is upgraded, that it's recommended, in fact, that a homemade mask be used in those circumstances. It's very important to note that people should not be using healthcare masks, such as N95 masks or surgical masks or procedure masks, because there's still a shortage of those, and they are needed in the healthcare environment to protect healthcare workers and patients. So what we're talking about in the community is homemade cloth masks, and it's also important to know that the evidence shows that if they're helpful in preventing transmission from to other people and not the other way around. And also that you need to be very careful about all the other precautions being in place. So you have to continue to physically distance. We wouldn't want this to be a false reassurance for people to then allow them to relax those other controls. So they got to keep up the physical distancing and the hand washing, and you have to be very careful about how you put them on and take them off as well, so that you don't contaminate your hands and then potentially infect yourself or contaminate surfaces that can infect other people. On our website, we do have information about masks, how to make masks, how to maintain them, how to clean them, when they should be cleaned. Basically, if they become wet or soiled, they should be washed in your washing machine. So we have specific instructions about how to do that. The Premier has been promoting testing, even the idea of random testing in certain sectors. He's spoken into certain working environments. I do see that as we open up the economy and working environments and other physical social venues for people, that we need to continue to learn and evolve our thinking about testing. And we need to certainly have employers looking for, among their employees, potential cases. We need people to be screening their employees and excluding them from work if they develop symptoms, and sending them for assessment and testing. And if
useful, and I understand that the province of Ontario will be participating in that. That will be an important adjunct to our overall testing strategy. And of course, we want people to be able to access assessment centers in Simcoe, Muskoka if you have symptoms at all, even a single symptom. We are promoting that very broadly now as a health unit, and certainly want people to be aware of that. And if you have any questions, please come to our website about testing and testing opportunities in Simcoe, Muskoka. We've got on our website now a posted PowerPoint presentation about a new model looking to the future about COVID-19. This time, it's not for Simcoe, Muskoka alone. We did one early in April that projected cases potentially throughout the month in Simcoe, Muskoka. And also that model projected out a 2-year period with different scenarios. And in that model, we came to certain conclusions. One was that we need these control measures, the physical distancing measures, the testing and the case and contact follow-up to be in place at least intermittently, if not all the time, until we can protect the population with a vaccine, which we don't expect until next year. And if, in fact, we stop doing those things, then you get a surge in cases that could overwhelm the healthcare system. And in our model last time, we projected the number of cases that we would expect through the month of April, as well as the number of deaths. And we had actually very high concurrence between what the model projected versus our actual experience with cases and mortality. So now we have a new model. This one is meant to be for the province as a whole, and it doesn't actually give you case counts. What it does is demonstrate, once again, the importance of us maintaining physical distancing, that there has to be a high degree of compliance with that, even now, going forward in time. So as we open up the economy and work environments, and potentially later on the summer camps, we're still going to need control measures in place. We're still going to need, despite all of that, people maintaining a 2-meter distance from most people, apart from your household members. And the hand washing is going to have to continue, and people are going to have to self-identify if they have symptoms and isolate and seek testing. And we're going to have to maintain testing of those who have symptoms for sure, and a really good follow-up here for us in public health with those that are cases to identify their contacts and put them into isolation. That's going to have to continue. Our model shows that if we discontinue it, then it can get out of hand again. You can get a resurgence of cases again. It can exceed the capacity of our healthcare system and our intensive care units. That can happen in as short a period of time as 2.5 months. So I think it's important for people to be aware that we're going to have to continue to be good with this, even as the weather improves and even as we go out and enjoy ourselves. And even as we have some other venues open up, we still are going to have to continue to be good with all of this. So people can certainly have a look at the slides that we've got up on our website now under health stats. So some of the questions that have come up. The last time I spoke, there was a question about the workload of contact tracing. So what I've gotten back from my staff is that on average, we're managing between 150 and 200 cases and their contacts per week. Although we've had a bit of a drop lately down to approximately 100, which is a very good sign for us. Once again, I wouldn't want us to be complacent about our physical distancing. Has the health unit experienced any significant delays in receiving testing results back? Did the work to test long-term care home residents and staff delay any testing in your region? So we certainly tested an awful lot of people. Over 7,000 people were tested in a 2-week period. And our experience was that did create some, for one, complexity for us to deal with a large body of test results, for us to receive the results back, and actually the logistics of us submitting them in the first place. And it did appear to create some lag in test results coming back. The lag from March to today, on average, has been about 2 days. Currently, averaging less than half a day, so we're doing well now. And I would say that there have been some outliers, so they've had to, in order to build up the lab capacity in the province, recruit hospital labs and private labs, and so we've had to be vigilant in following up on some of those lab results in some cases to make sure we get them. But on the whole, the lag has been formally about 2 days. Where should the province place the emphasis on its testing strategy as it reopens the economy? So we've certainly, as I said, heard from the Premier speaking to wanting to test in work environments. I am aware of very large employers, manufacturers, that have comprehensive surveillance plans, even temperature monitoring plans for themselves, and also have identified how they will expedite testing being done for their employees. So certainly I encourage that kind of thinking for workplaces, that they would have that kind of system thinking in place and know how they would expedite getting testing done for those that are symptomatic. I am also aware that some are calling for asymptomatic tests to be done. It's not clear to me the value of that. I would say that the province's experience when it looked at the results that they got from testing asymptomatic people without symptoms in long-term care facilities, residents and staff, was that only 0.2% of those test results turned out to be positive, and it's unclear how many of those positives were true positives as opposed to false positives. When you test large numbers of people in a population where you have no symptoms and a low prevalence of infection, then you can actually have the majority of the very few positives that you get being false positives. So it's unclear to me the role of potentially random testing of asymptomatic individuals for acute infection. I've spoken before about the value of a seroprevalence study looking at people's immunity. I do believe that there'd be great value in that, and that both the Health Canada and the provincial government are going to be proceeding with that. So here is a question: would you consider conducting random testing in the community like the health unit in Windsor that have announced this today? I would say that I would want to learn from their experience, and I would say also follow what the province may ultimately direct us to do. At this point, we are not considering setting up a similar random testing process here in Simcoe, Muskoka. Another question: with the Premier's announcement this week that school buildings would not be reopened for the rest of the school year, now parents, teachers, and students are wondering how they can safely get into the schools to gather their belongings, according to our two school boards, two of our school boards here, the Simcoe County District School Board and the Simcoe Muskoka District Catholic School Board. They are waiting on advice from the health unit on the best way to coordinate this endeavor. What would be the health unit's advice on this? Are there any plans in the works yet? Is there any approximate timeline on when this would happen? I would say that I've been involved in discussions on that provincially on the public health measures table, and also here locally we would be prepared to support our school boards in this. I believe that when they proceed with this, they'll have to do it in a careful way, that they will have to avoid people becoming inadvertently crowded together or coming in contact with each other together as they go to get their belongings. So it's going to have to come down to a booking process, staggering people coming through in time so that they don't have too many coming in at once, and having them instructed to maintain physical distance from others. They do so. Only a limited number of people, one person per family, would be best to go in and do that job, and that the schools would have to maintain excellent disinfection throughout. So I'm sure that it can be done safely, and I have no doubt that in fact it will be done safely. Aside from healthcare workers, how many unique residents of Simcoe, Muskoka have been tested for COVID-19? So we don't have data that separates how many healthcare workers have been tested. We know that a quarter of our positive test results have been healthcare workers, but we can't really, I can't definitive report right now about how many of all of those who've been tested in Simcoe, Muskoka are healthcare workers. To date, we've got a total of over 15,700 test results that have been done, and the great majority of those, over 15,000 of those, have been negative. We also know that that includes the over 7,000 people that were tested in long-term care facilities, which includes healthcare workers, but also includes the residents. So I've got the total figure for you, but I don't have a breakdown as to what proportion of those are not healthcare workers. There's a question here that says, are you fearful restrictions and attitudes have eased too much, and this will result in an overwhelming of the healthcare system, producing a shortage in ICU and ventilator treatment capabilities? I think we need to be ever on guard for this, and this speaks to the findings of our modeling projections, that possibility exists, and therefore we need to be very careful about relaxing our controls. We need, even when we relax the controls on business locations or public venues, we have to continue to maintain the physical distancing. People going into those venues or people working in those environments have to maintain physical distancing, and also have to maintain the excellent hand washing. And now we have the recommendation about mask use as well when you can't exercise physical distancing, and those who have symptoms need to go into self-isolation and be tested. So we will have to keep that up, or we could very well end up with a surge. It could be this kind of worst-case scenario of overwhelming the healthcare system. I think we should take heart in the fact that we managed to flatten the curve starting in March and to avoid that kind of a disastrous overtake of the healthcare system. We certainly have had tragedy in our long-term care facilities with so many outbreaks and deaths occurring in long-term care, but we did manage to avoid the healthcare system being overwhelmed and greatly reduce the number of cases that could have occurred here. We do know from our own projections that if we'd not flattened the curve in Simcoe, Muskoka, instead of having under 500 cases, we would have had over 16,000 cases, and that number grows exponentially week by week, the difference between what we've experienced versus what we would have experienced without flattening the curve. So the potential is there. We'll need to keep up our vigilance. We'll need to keep up the surveillance, the testing, the case and contact management. What is the advice to those heading north and others expanding their contact group? Is it too early to do so as infection rates increase? So I have indicated before that when the time is right, I would be supportive of the idea of an extended social bubble for people, that people right now are essentially confined to your household for intimate contact. And when the time is right, it would be great if we could expand that a little bigger, maybe to one other household or a total of 10 people, mutually contained, no others coming in and out. But the time is not right for that. Provincially, we've seen a little bit of an increase lately. Maybe Simcoe, Muskoka over the past week or so had some decrease, which is hopeful. But before that, we had a bit of an increase. I think it's premature And I regret this myself personally. I'd very much like to be able to extend my own family household bubble, but I believe right now it's a bit premature for that. We'll just have to wait until we're ready. And I've spoken before about people going to their secondary residence. This is on the basis of differences in disease rates or incidence of COVID-19 to the south of us in the larger municipalities, quite a bit higher than here, three times higher than here on average. And therefore, I would be advising people not to be going to their secondary residence. I still think that that concern is in place. I still recommend that people go. So at this point, I would be happy to take questions.
Okay, thank you, Dr. Gardner. And before we take the questions, could I please remind everyone, if you're not asking a question, to stay on mute. We're having some static on the line here. Thank you. We'll start with Mike Arcelades from CTV Barrie.
Thank you very much, Leslie. Doctor, yes, thank you for answering a lot of those questions. Have we tested enough people, in your medical opinion, or should more have been done right now to test more than that 8,000 population outside of long-term care homes?
Well, if your question is about testing of asymptomatic people in other concurrent settings, or congregate settings, such as nursing homes, group homes, correctional facilities, at this point in time, we aren't proceeding with that. We note the very low positivity return that came back provincially on that, 0.2%. We note our own experience, although we did have one home that had 3 individuals that were positive. Their tests came back negative after. We have to decide how to interpret that. We certainly were able to respond to the homes in outbreak, but that was without the testing of asymptomatic individuals. We certainly agreed, even before the province instructed us to do so, to test all people in those homes when they're in outbreak, whether or not they have symptoms. We certainly intend to continue to do that if we have outbreaks or potential outbreaks in any of these settings. But at this point, I'm actually more concerned about the work environments that are opening up as the economy opens up, and I want to be able to turn our resources to that new front, that new potential location of infection. I think we need to have our staff freed to be deployed to manage that front instead, and to advise those work environments about the precautions they need to have in place, and to be able to facilitate testing in those environments if need be.
So you're not concerned with low testing rates here in Simcoe, Muskoka? You feel they're right on par with where they should be?
They are lower than the provincial average, but in fact we've otherwise been successful here. We've actually had low infection rates compared with the province, half the rates. We know that we've saturated with testing sufficiently to meet standards. So our what we call test positivity rate is 3%, the same as the provinces. That's an indication of whether or not we're doing enough testing to pick up cases, to pick up what's out there. So having a very low number means you're saturating, you're testing a lot and seeing only 3% come back as positive. To me, it's not just about testing. It's about identifying where your risks are in the community and helping remove those risks, having reduced those risks. So if our risks that are opening up now are in the workplace, then we need to be engaging the workplace about their risks and helping them deal with that. And even before you get into testing, you've really got to be talking about how to avoid people getting exposed in the first place. What kind of control measures need to be in place in those work environments so that people can physically distance, so that they are disinfecting appropriately, so that they're limiting the number of people in those environments so that they don't become crowded. And then how do they pick up people that are symptomatic that then need to be tested? And then do we have enough capacity here with our assessment centers and our laboratories to be able to test when needed those people in those environments. For sure, we want to continue to be monitoring closely and working with the facilities that I've talked about, congregate settings, and we've assessed them for their vulnerability, and we're working with those that are more vulnerable to reduce their risk, and we will test them when we see that there may be some cases. But to me, it's not just about testing. It's taking this holistic approach of which testing is a part.
Thank you very much. You think the infection rate is 10 times as much as what we believe it to be out in the population, with everyone having been in the bunker now for the last 3 months?
It is, well, it is true, and I've said this all along, surveillance is the tip of the iceberg, and it is possible that you've got 10 times as much or even more infection in the community than what we see with surveillance. We know that from the seroprevalence studies that have been done in places such as New York City, where they had a very high test count, but when they did the seroprevalence study, they found that they had more than 10 times the number that were actually immune and therefore had been infected. That is the nature of surveillance. It's partly because a certain number of people will have no symptoms at all, and random testing in the community will not really address that issue. You would not be able to test absolutely everybody in the population in order to find those other individuals. What does address that issue is physical distancing and hand washing and self-identification and self-isolation when you develop symptoms, and now more recently the recommendation about masks.
Thank you so much. Have a safe weekend.
You too.
Okay, we'll move on to Chris Simon from the Barrie Advance.
Yes, thank you very much. This week, Dr. Gardner, there were 12 cases in New Tecumseh, which seems a bit high considering their previous case count and their population, and just wondering if there's any link between the cases.
So I don't know specifically about those 12, but we did do a look back at a couple of our municipalities at the request of the local municipalities, and we didn't find a particular location of concern. There wasn't a particular pattern to it that helped us, and therefore that really took us back to the general messaging that people need to be aware that transmission is happening in their community and that they need to take their precautions when they go out. They need to do the physical distancing and the hand washing and the self-isolation.
Do you think that we're going to get to a point where we collect enough data on each of the individual municipalities where we might be able to begin to target or identify trouble spots?
I would say that could only be possible if that's actually the issue. But I believe the issue is that it's generally circulating in the community and not local. It's not focal in particular spots. But, you know, if in fact that's the case, you may eventually get enough data that you could demonstrate that. And, you know, I really do appreciate the fact that through plotting the data by municipality, we get questions like that, and we can look into that from time to time to see if there's something there. But I think the safest takeaway message for everybody is it's generally circulating, and they have to take their general precautions.
And one other question, if I may. The provincial numbers today, not particularly good, but we seem to be maybe going the other way. You know, if those trends continue over a longer period, would you be in favor of maybe loosening some of the restrictions locally, even if it can't be done province-wide?
If I understand you, you're asking me, would I support our local municipalities somehow easing up on restrictions if the province isn't willing to? Is that what you're asking?
Well, I'm just wondering, you know, if the state province-wide, the numbers continue to not decrease on average, whether, but they do locally, whether it would be a wise decision or whether it would even be feasible to maybe loosen some restrictions in Simcoe, Muskoka, as opposed to province-wide.
Well, we wouldn't have the power to do so since these restrictions are placed by the provincial government. So it would be beyond our ability to do it. I don't know if it'd be wise anyway, because we're not that far away from the GTA, for example.
Okay, thank you. Mandy Webster from Rogers.
Hi, Dr. Gardner. I have a few questions for you. My first one is, do you have the total number of patients and staff at Owen Hill?
Let me have a look through my notes. At Owen Hill, there are 75 staff and 55 residents in total.
Wow, and they had 48 cases, I believe you said?
Yeah, I'm sorry, I can hear some background noise, and I ask that everybody mute your line, please. Thank you. That gives an overall, what we call an attack rate, the percentage of people who've been infected, of 36.2%. That is high.
Thank you. And are you concerned that when we're kind of let out of isolation that people will have lowered immune systems?
Well, I would say that one of the disadvantages of flattening the curve through the means that we've done is that people don't get immunity. You are deliberately avoiding people getting infected. And so only a very limited proportion of the population gets infected and then develops immunity. And we've seen through the seroprevalence studies that I've alluded to that you can have very low levels of immunity in the population even when there's been a significant amount of infection. So it can be in the range of 2%. In the case of New York City, it was up to 20% of the population that had developed immunity, which means that the great majority of people are still vulnerable to the infection. We're still vulnerable as a society. Hence, you're still caught in having to keep these control measures in place until we can make everybody immune through vaccination.
Yeah, and sorry, I mean to clarify, I don't just mean lowered immunities to COVID. I mean just like in general to the common cold, to flu, to our normal things that we would normally fight.
I don't think there's any evidence of that. We actually saw quite a dramatic reduction in the tail end of the season of influenza when we put in place these control measures for COVID. It led to an abrupt end to the influenza season because the control measures were also effective for influenza. And these viruses mutate, as does, there's some media coverage about COVID changing over time too, genetically mutating. But these viruses mutate such that you can develop immunity to this year's strain of influenza or colds, and then they've changed on you. And next year, you're vulnerable again to the new strain.
Thank you. And one last quick, yeah, it does. Thank you. And one last quick question. Did you mention that on the Simcoe Muskoka Health Unit website, there would be a place for more information in regards to the random antibody testing?
I didn't say that. I said that we were posting our modeling projections. So I don't have any information about the seroprevalence study you're talking about, the random antibody testing.
Yeah, I'm sorry, I must have misheard.
Yeah, we don't have any information about that.
Okay, thank you. That's all my questions. Have a great weekend.
You too.
Thank you. Erica Engel from Collingwood Today.
Yes, hello. My questions are about Collingwood Nursing Home. You said you've had negative tests back. Is that negative tests for all 3 women? And how many negative tests did you get back?
We've had one set of negative tests on all three of the patients, the residents who had been positive with the first round of testing.
Okay, and are they getting another test to confirm that negative, or what's happening there?
I need to follow up with my staff about that and also the interpretation of it, whether we're starting to think these are false positives or what. For now, of course, we're maintaining the home in outbreak status as the most precautionary thing to do.
Thank you very much.
You're welcome.
Okay. We'll move on to Dawn Huddlestone from the Huntsville Doppler.
Thank you. I do have a question about with all of these measures starting to be relaxed, at least in North Muskoka, we're starting to see longer lineups at stores as people get out doing some shopping and probably catching up on things that they hadn't been doing. And yet our case rate remains quite low. So I'm wondering, Dr. Gardner, if you're a bit concerned that in areas like this, people might start to disregard some of these recommendations, thinking that it's not an issue for them here.
I'm worried about it in general. I'm worried about it in all of my territory. I have physically seen it myself recently in Barrie, where I live. It seems more people are out enjoying the weather, which is fine, but there seems to be people out in groups, which is not fine at all, in close proximity to each other, not 2 meters apart. Maybe it's my age showing by saying this, but there seem to be in particular very young people, youth, that are doing this. So I'm concerned with that as a risk behavior and the potential for that to lead to more transmission.
Okay, thank you. And then when I look back at the case counts, there was a definite spike in numbers a little less than 2 weeks after the Easter long weekend. I know that we've heard anecdotally that things weren't quite as busy here the May long weekend, but are you anticipating maybe seeing a spike like that again in a couple of weeks? And do you find that unusual that that spike came near the end of what's considered to be the symptom onset range for this virus?
You know, you raise a good point now that I look at it. There is a bit of a spike. One does have to wonder. Fortunately, it doesn't appear to have continued, but we shall see. And for sure, we need to continue to monitor what happens. It is unfortunate that you have to wait 2 weeks or more after the exposure before you're going to see it in your data. I guess we need to be advising people that need to be cautious. They can't be taking it for granted that this is over. It's not over at all. It's waiting to resurge.
Great, thank you.
Okay, we'll go on to Brett Glover from Barrie 360.
Actually, Doc, you've been very thorough. You've already answered my question, so I'll just say have a great weekend. Hope you enjoy the weather.
You too.
Okay. All right, then James Bowler from Cogeco. James is gone. All right, we will then go on to Jessica Owen from Barrie Today.
Hey, it's Erica. Jessica messaged me. She had to go too.
Okay, and so we won't expect another question. Then we'll go on to Nathan Schubert from Moose FM.
Good afternoon. Dr. Gardner, 2 questions for you. First is following Premier Ford's talking about how we might roll back on this first phase if things go out of control. How do we avoid a second wave with things slowly opening up?
Well, it's a great challenge, right? Because our data, our modeling shows that no matter what you do, you've got to maintain your physical distancing. So, you know, opening up the economy and opening up work environments can be contrary to that if people don't deliberately keep their physical distancing regardless of all of that. And, of course, we have to continue with our testing and our case and contact follow-up as well. We know that if you lose out on those 2 fronts, you'll get a surge. So I think the Premier's warning to the public is appropriate.
And my second question here is, how can we get more testing? Because earlier you were saying that while reasonable, is there a way we can kind of up our testing in the area?
So we need to make sure that people have access to testing, right? We have to make sure that the model that we have with the assessment centers is working for people. It may very well be that there are vulnerable people who can't get into test, people who don't have transportation, for example, or people who have health conditions that don't allow them to get out. And I don't know how to overcome that. I think we need to give some thought to that. We're going to be living with this virus for another year and a half or so, or more. So we should think in terms of how to do this well, right? That it's not going to be over, so we have time to continue to improve this. Are there other ways to help those who can't get to those centers get tested? Are there ways to have primary care also doing it? Are there ways to have work environments facilitating testing for large employers? Are there ways for hospital emergency departments to be able to do more of it? The point of care testing that could be used in remote communities is a possibility in the future. We don't have that now. We could use that when it comes. So you can think of various ways to just make it easier for people to get tested in the first place. I don't know if the random testing of asymptomatic people will ever yield much. With the acute testing, the PCR testing for the virus itself, like I said, we had a very low yield, very low positivity rate with the testing in long-term care facilities. So I don't know if that will ever be helpful. But I do think that facilitating, making it really, really easy for people who have any symptoms at all to get tested would be very helpful.
Thank you very much.
Okay, thank you, Nathan. Is there anyone who joined us late and didn't get a chance to ask a question?
Hi, it's Doug from the Simcoe region.
Hi, Doug. If you'd like to go ahead.
Sure. So I kind of put you on the spot, Dr. Gardner, last week asking about jurisdictions and countries thought had done well in dealing with the pandemic in terms of best practices. I'm going to flip the question. Are you watching any jurisdictions, and I'm thinking south of the border in general, that you're kind of saying, oh boy, some bad things are coming their way?
Well, of course, it's a less diplomatic thing to speak about those who aren't doing as well, but I would say that it's fair to say that the United States has more than twice the per capita rate of infection and death rate compared with ourselves. That they've got a lot of mixed messages among leadership about the control measures and maintaining them versus relaxing them, that you've had a relaxation of the control measures while they've had very active transmission happening in many of the states. So those would be, I think, examples for our caution. We've had countries that put in place the control measures late after not wanting to do it. So Britain is a good example of that, where at first they wanted to take an approach of allowing for broad infection and herd immunity and just protecting the vulnerable, and found that people weren't willing to send their children to school under those conditions. So then they put in control measures late and ended up with a very high mortality rate out of it. We see that among the Scandinavian countries, that Sweden took a very different approach and not being nearly as rigorous about their control measures, and they have a substantially higher per capita mortality rate than the other Scandinavian countries such as Norway or Denmark. So I think that those would be examples for us to learn from. I know that a lot of South American countries have really struggled with this. I know that right now Brazil is struggling with this. Their leadership, once again, has had mixed messages about its importance and the importance of the control measures. And their having a rapid growth rate and rapid mortality growth rate. So there are countries that are definitely struggling with this right now, and I think we need to be careful ourselves. We need to learn from the best and put in place the learnings from the best. I guess cautionary learnings from those that haven't done as well. And this is going to be with us a long time, so we have plenty of time to do better or plenty of time to not do well.
Any follow-up, Doug?
Yeah, great answer. And secondly, I've seen a real about face in the last 2 weeks on the discussion of masks, and I think a lot of it's got. Would you say a lot of the hesitance is just because of the N95 supply, and that you don't want to impact that by issuing a general mask order?
Well, it is important that we maintain N95 masks, surgical masks, and procedure masks for the healthcare system because we remain in shortage, and they are very important to be used in those environments. I'm totally supportive of universal masking, wearing a mask by healthcare workers at all times in the healthcare environment to protect themselves and protect patients. With asymptomatic transmission without symptoms, you can't just focus on the known cases. You've got to be taking that universal approach in that environment.